Hi everyone, my name's Geneva and I'm the Education and Volunteer Coordinator for the National Marine Life Center. I'm coming to you today to present Marine Animal Medical Mystery. This is one of our programs that we would typically offer during our April vacation week or any other vacation week, but right now we're all remote learning together at home. So I hope you are all safe and well. These videos were pre-recorded at the National Marine Life Center before the stay-at-home order was given. Many of our staff and volunteers are still on site as we are an essential business and working to continue to care for marine animals and sea turtles, our rehabilitation mission, and continuing to bring you education programs. Today's marine animal medical mystery will feature a little bit of natural history to start with, and then we'll transform you all into marine animal veterinarians to examine a patient. So let's go ahead and get started by learning a little bit more about our pinnipeds. Hi everyone, today we're going to be talking about the family of animals known as pinnipeds. Does anyone know what pinniped means? If you peek at my friends, you might get a good idea. You're right. Pinniped literally means flipper-footed or fin-footed. All of these animals, or stuffy versions, have flippers or fins for feet or limbs. I have a couple of friends up here that we're going to talk about and distinguish who is who. Now, I'm going to put my hand over each of these friends, and you can tell me which ones you think are seals. And I know this friend is a little bit hard to see, so we'll just do that. All right, is this friend a seal? Is this friend a seal? Is this friend a seal? You're right. These two friends are seals. This friend, does anyone know what he is? He's a sea lion, a California sea lion. Pinnipeds are divided into three family groups: true seals, phocids, eared seals, otarids, and the walrus that I don't have a friend for today, the otobenids. We're going to focus on the phocids, the true seals. You might have mentioned or heard eared seals. Those are the sea lions and the fur seals. They're not really true seals. They're distinguished by their external ears. Everyone go ahead and put up some Shrek ears. They have outside or external ears that can wiggle around. True seals, phocids, do not. Otarids, those eared seals, also have something very special. What is special here? They have long front flippers, and their back flippers point underneath their bodies. They can rotate them around like we can rotate an ankle almost, and those limbs are underneath those back flippers. So sea lions and fur seals, the otarids, can walk on land. Can phocids or true seals walk on land? No, they can't. They will bounce, just like a beach ball. Their front flippers are very stubby, and they can't really push up their weight very much. And their back flippers, which they have two of, that kind of hide their tail, where do they point? Do they point underneath the animal or out behind them? Out behind them, you're right. Now, this friend, if we take a really close look right there, what do we see that should not be there if this stuffy were correct anatomically? That ear. True seals, phocids, don't have ears. So we'll pretend that this stuffed animal does not have those ears. Now, all pinnipeds have whiskers. Some stuffies have just kept theirs longer. Seals also have something special on their flippers. What does this friend have here? Claws. Sea lions, the odorids, the eared seals, do not have claws, and their flippers are pretty leathery. Whereas true seals, they have fur and fuzz all the way down covering those flippers. You can also tell a difference between a true seal, the phocids, and my friend the eared seal, the sea lion here, not a true seal, by their coloration. That's not the best way to identify them, but it'll give us a little bit of a hint. Seals might have, true seals, a pattern like this black harp. You can meet one of our harp seals if you watch our patient updates live. Meet Mactinicus and Curtis, and you'll see they have a black marking very similar. Some of them look solid colored, like this harp seal pup. Pups are all white for many species of true seals. This fur that's all white and very, very soft is called lanugo. As the pup grows, and sometimes before it's even born, that lanugo goes away. For harp seals, they'll be born bright, fluffy white like this, and over time become gray with spots, and eventually gain a harp pattern. Other seals have spots like gray seals. For gray seals, the girls are light with dark spots, and the males are dark with light spots. Harbour seals also look pretty speckled, whereas the eared seals are almost always solid colors. So if it's spotty or mottled or has a pattern, it's probably a true seal, a phocid. If it's all one color, it's probably an odorid, that eared seal that's not a true seal. Let's take a closer look at the difference in color between two models.
Here is a Harbour seal. You can see that speckled coat pattern along with the back or rear flippers extending out behind the animal and the shorter, stubbier front flippers. You can also see that this model lacks external ears. Now here is a sea lion. Note the difference in color. It's a solid, uniform brown color with long front flippers and rear flippers that extend to the side and can be rotated underneath the animal to allow it to walk. You'll also see that this species of pinniped, the California sea lion, along with other sea lions and fur seals, has the external ear flaps.
Let's take a close look at another specimen, a pelt from a hooded seal. A hooded seal is one of the 4 species of seals that we work with here at the National Marine Life Center. The other seals we work with are harbour seals, great seals, and heart seals. Harbour seals and great seals can be found in Massachusetts all year. Hooded and harp seals are Arctic visitors. We should only find them around Massachusetts and New England from about January until April.
Here is our hooded seal pelt. Look at all the different shades of brown and into a blonder color that you notice. They also have these spots or blotches pattern. Let's take a closer look to see the individual hairs. Now you can really see up close what the fur or pelt of a seal looks like. You can see that the fur has different colors by individual hairs. Now we're going to take a look at what some of these different species of seal look like. Remember, there are 4 species of seals that the National Marine Life Center works with. This is a hooded seal. Nubble is what's called a blueback, where her back is a slate gray color and her belly is lighter. Over time, as she ages, she will develop the spots that you saw on the pelt. Let's see another hooded seal, one from a previous year at National Marine Life Center, Patronus. Here you can see a harp seal. Harp seals also have spots and are another Arctic visiting species. Harp seals, as they age, the males will develop a large black harp-shaped pattern on their back, like Metinicus that you're about to see. Metinicus was one of the first adult harp seals ever rehabilitated at National Marine Life Center. He weighed nearly 180 pounds. Here is a gray seal. Gray seals are a year-round species found around Cape Cod in Massachusetts and all over New England. Gray seals are sexually dimorphic. This means that the males and the females, the boys and the girls, look different. Males are darker with light spots, and females are lighter with dark spots. Gray seals are also known because of their large rostrum or snout. It looks pulled out and very horse-like, which has given them the nickname the horse-headed seal. Last but not least is the Harbour seal. Smaller than gray seals, they are also a year-round resident. They are speckled in color or spotted, and are usually lighter or more brownish in color, but can range from light brown to a dark gray. They have a shorter rostrum or snout, and are more dog-headed than horse-headed. Harbour seal pups are usually born with an adult patterned coat that will darken with age, but some of them are born with a fluffy white or yellow coat. This is known as lanugo. Lanugo is a fetal fur that will go away as the animal ages. For many species, this lanugo would be gone by the time they are born. When a Harbour seal pup is born with lanugo, it's a sign that the pup was born early or prematurely. Gray seals, however, may be born with lanugo, but it will be shed within 1 to 2 weeks after they have been born. This is a Harbour seal pup, Johnny Apple Seal, who was premature, born early with a lanugo coat.
But there's one group within the pinnipeds that I haven't talked about a lot. It looks like a seal. It doesn't have external ears, but it has the leathery, movable flippers of an odorid, and it has 2 tusks. What pinniped am I talking about? A walrus, you're right. So, I'm actually going to be able to show you a walrus tusk. Let's take a look.
This is a walrus tusk. It is solid ivory and is very heavy. Walruses will use these 2 tusks on the front of their face to help haul themselves up onto ice floes in the Arctic. This is the line where the root goes up into the jaw of the walrus. The rest below is what would be protruding out.
All right, I think you all are pretty ready to become marine animal veterinarians. So, let's take a look at a case. Welcome to Seal Marine Animal Medical Mystery. Thank you for joining me, doctors. I really need your help. The National Marine Life Center just got a call about a seal stranded right here in Buzzards Bay, Massachusetts, near the National Marine Life Center. Luckily, our team received authorization to go out and collect the animal. Typically, we can't do that, but this was an urgent case. Thank you. This seal needs to be diagnosed and observed. Let's figure out how, as marine animal veterinarians, we can treat this animal. When you're ready, go ahead and make sure you've printed your Marine Animal Medical Mystery Seal admission sheet. Make sure you choose the correct sheet for your age group. All right, doctors. The first step to admitting a patient into the National Marine Life Center's Marine Animal Hospital is to identify the animal. First, we have to identify them to our own staff and volunteers. That means that we're going to give the patient an ID number and a name. Go ahead and take a moment to come up with an ID number. You can use things like your birthday, the date of your favorite holiday, today's date, or any other combination of your favorite numbers. Take a minute also to come up with a patient name. Choose whatever name you like. The reason that we give our patients a name and identification number is because when we're giving out directions for each day, when we have multiple patients to care for in the rehabilitation facility, it's a lot easier to say, Savannah, can you go give fish to Scuttle? Instead of, hey Savannah, can you go give fish to NMLC 000812Z-6? And then repeating that for 12 other mouths to feed. So, once you've selected your name and ID number for your patient, let's move on to the next step. If you're using Form 1 for your marine animal medical mystery today, the next step will be to determine where your animal stranded. This is all done by imagination. Pick a place where you would like this animal to strand. Or go back to the beginning of this video where I gave details about where this specific seal stranded right near us. Your next step is to identify your species. Go back to an earlier point in this video to review what some of the common species of seals found in Massachusetts look like. Great job, everyone, on identifying your species. You are working with a seal pup. Your seal pup might be any of those 4 species. Depending on the time of year, it's more likely that you are working with a Harbour Seal pup. Harbour Seal pups that have their lanugo are very, very young. They will need excellent care and will need assistance from our veterinary staff and animal care team to get better and learn how to eat on their own. Let's get them admitted to the hospital. The next step for both Form 1 and Form 2 is to make medical observations. This is important for our veterinary team and animal care team staff in order to learn and remember what is wrong with this patient at the time of their arrival. Take a moment to draw in any injuries, illnesses, or things that don't seem right on your form. Make note that your diagram has a left and right side. You can use different colors, pens, pencils, whatever you have around to draw in your observations. I would love to assist you in this process. I'll go ahead and assist you by moving our patient around very gently. Here at the National Marine Life Center's Marine Animal Hospital, this would typically be done by at least a team of 2, working with a towel, borders, and restrainers. Because our patient is a bit docile and is a stuffed animal today, I'll be able to move him for you so that you can look at all sides of this animal to complete your medical illustrations and observations. This is the animal's right side. This is the animal's left side. Right side, left side, view from the back, view from the front, and let's take a look at the ventral side. Everyone take a moment to say ventral. Nice job. Ventral means belly side. Any guesses as to what dorsal side means? You're right. Dorsal refers to the back or the top side of a patient. Now that you've completed your medical illustrations, the next step is to take some measurements. There will be different measurements for Form 1 and Form 2. Let's go ahead and get started. One of the first measurements we take is called a straight length. A straight length goes directly across the animal. As you can see, my measuring tape is straight. If we were to do a curved length, we would be following the curve of that animal. It actually makes the measurement longer. It's important to take a straight length where it's supposed to be, as those go into calculations used by our veterinarians later on. Let's take the straight length of our seal patient from nose to tail. Estimate where your patient's nose is and where that tail is. As scientists and veterinarians say, should we use inches or centimeters? Centimeters. You're right. I'm laying my measuring tape right alongside this patient. And it looks like I'm going above and beyond because of this video, but I'm measuring right from the tip of the nose to right at that tip of the tail. I'm going to show you the measuring tape so that you can record the measurement for your own chart. Take a look at this measurement. Great job, you're right. This animal's straight length is 55 centimeters. Keep in mind, I'm working with my patient here that's also your patient. If you'd like, you can record these same measurements and do the exam for your own stuffed animal at home, and it does not have to be a seal today. The next measurement that we'll be recording is the maximum girth. Girth is going around the animal at the widest point. Why do you think it would be important to measure girth? Exactly. If an animal's maximum girth, or how big they are around, is too small, that means that perhaps that animal is not feeling well and may not have been eating recently. To measure the maximum girth, you'll take your measuring tape and go all the way around your individual. At the National Marine Life Center, this would be done with a team of at least 2 crowders for boards, restrainers, and teams to observe and take the measurements. We're going all the way around, right behind the front flippers or under the armpit, and measuring at the widest part. And of course, we're scientists here, right? Right. We're going to use centimeters again. If you're using a measuring tape at home, centimeters are on the smaller side. Centimeters are part of the metric system. Take a look at this. Great job. This animal's maximum girth is 61 centimeters. I'd say that's pretty good. The next measurement we're going to take is weight. Sometimes we can calculate this using a scale. I'm going to bring out my scale right now. The scale we have at the National Marine Life Center in our Marine Animal Hospital is really big. I would not be able to carry it over here to our education building for this video. If you've been to the veterinarian with your animals and seen the dog get on the scale, we use a very similar scale here at National Marine Life Center. This is the scale we'll use today. Our patient is on the scale. Take a look at what the scale records and record it on your admission sheet. Great job. Our patient is about 25 pounds. At the National Marine Life Center, we measure weights in kilograms. To go from pounds to kilograms to convert, simply divide the number of pounds by 2.2 to get kilograms. For simpler mathematics, divide by 2. When you divide by 2, that's an estimate of kilograms from pounds. If you're using Form 2, we'll go on to take additional measurements. If you're using Form 1, the next step is to combine your measurements, your observations, and your imagination to diagnose our patient. You can see potential diagnostics at the bottom of the page. Go ahead and circle what problems you think our patient might be suffering from. If you are using Form 2, we're going to take additional measurements now. We're going to examine the heart rate and respiration rate of our patient. At the National Marine Life Center, we will use something called a stethoscope to listen to the heart rate with our veterinary team. Let's take a listen. I hear a strong, healthy heartbeat from this seal pup. If you'd like to calculate an exact heartbeat or beats per minute measurement for your patient, you can use your own heart rate. To measure your own heart rate, you'll want to find your pulse on either your wrist or your neck. Find a vein, use 2 fingers slightly under the jaw, and you'll feel a pulse. Once you find that pulse, set a timer or look at a clock and count the beats that you hear or feel for 15 seconds. Go ahead and count the beats you can feel using your 2 fingers for 15 seconds. Great. Write that number down now before we forget. Now take that number and multiply it by 4. This will give you beats per minute. There are 60 seconds in each minute. Taking 15 seconds, multiplying it by 4 gives us 60 seconds or 1 minute. Respiration rates are observed for our patients by looking at their breathing. We can observe breathing or respiration rates by looking at the nares. Our nostrils are a seal's nares. We can look at them flaring them. Can everyone flare their nares? We can observe seals blowing out or opening up their nares wider for breaths. If they're in the water and we're trying to get a respiration rate, we might observe them surfacing to take that breath. Go ahead and count your own respiration rate again for 15 seconds. Remember that one breath includes 1 inhale and 1 exhale. That counts as 1 breath. Count the breaths you take for 15 seconds and multiply that value by 4. Great job taking those additional measurements. Form 2 specifically lists examining a radiograph or an X-ray. Both forms and all players today are welcome to look at the image of our radiograph. Check out that radiograph here. What did you think about that radiograph? What might have caused that injury? Go ahead and write down those observations on Form 2 where you see radiograph or X-ray. For Form 1 users, you can use the back of your sheet to write additional diagnostics, including radiographs. Great job! The next step for Form 2 is to look at a urine or fecal sample. Urine is pee, and a fecal sample is poop. We take these samples as a way of looking for parasites, small organisms that live inside or on different animals in a harmful manner. We can look at these samples to find those organisms and to look at different metabolic rates and different levels of chemicals within the body. Go ahead and imagine that you are collecting a fecal or urine sample from your patient. We would examine these samples under a microscope. Use your imagination to determine if you found parasites in your fecal sample for your patient. Did you find any parasites? The last step, for those using Form 2 for Marine Animal Medical Mystery, is to record water quality value for that day. Water quality is something our animal care team measures 2 times a day, and we measure pH, which is the acidity or baseness level of a chemical, or in this case, water. We also measure temperature and salinity, how salty the water is. Go ahead and imagine values for that patient's pool. Keep in mind, seals and most marine animals will only be able to survive in water that hits certain parameters. For example, we would not want to swim in lemon juice. Lemon juice is highly acidic. A neutral pH, the water that we drink, is 7. Congratulations, you've diagnosed your patient. What did you think was wrong with this patient? He is entangled. Let's go ahead and disentangle our patient. Go ahead and help me unwrap the fishing rope from this patient. It's important to note that it's all of our responsibilities in order to keep our oceans and our beaches clean from marine debris like this fishing rope. By cleaning up our beaches and our oceans, we can prevent animals like our patient from having to be rehabilitated in those situations. Great job! Now that we have our diagnoses, we can recommend treatment plans. Some of the plans for treatment include common things such as medications that can be given orally through the mouth, can be given with food, some might be injected. Where do you think we might give a seal an injection, a shot? You're right. We typically give injections into the muscle. Sometimes we can give them subcutaneously or under the skin. Today, let's practice giving an intramuscular or into the muscle vaccine or injection. Seals have very big muscles on their dorsal side towards their tail. Remember, we have to draw up medication first. Go ahead with your imaginary plunger, pulling back to fill your syringe. Now, we'll go ahead and give that injection here on that intramuscular area, pushing the plunger down, and we're done. Great job giving that intramuscular injection. Another treatment that we can give is through fluids. Fluids is a fancy and quick way for our animal care team to say that we are giving subcutaneous fluids such as this. If you've ever been to a hospital or possibly a doctor's office and seen someone with a needle or a tube connected to their wrist or upper arm with a bag like this and a tube hanging down, that person, or even animal patients, were receiving fluids or medication. These can be given intravenously through the vein, where we would draw blood from, or subcutaneous, just under the skin. We'll be giving subcutaneous fluids, or sub-Q fluids today, right under the skin. Start by holding your fluid bag up high. Then, we'll go ahead and insert what would be a needle gently between the shoulder blades of our patient right here. Go ahead and get ready to insert. We're going to insert with the needle, or what would be needle, going towards the head. Now that our subcutaneous fluids are in, this can take anywhere from 10 minutes to 40 minutes or more, depending on how quickly those fluids can be absorbed by the animal into their body. Sometimes we'll even see a little bit of a growth happening where those subcutaneous fluids are going in. This is totally normal, and it means that it's working. Another treatment option is to help that animal increase in weight and get more food. With seal pups, sometimes they're still supposed to be with their mother. They're dependent. At that period, because they're mammals, what would they be drinking? You're right, they would be drinking milk. We don't have seal milk here at the National Marine Life Center's Marine Animal Hospital, but we do have our milk matrix formula, just like what we're able to give human infants who are using a bottle. We can create this milk matrix and give it to our seals, but we can't bottle feed them. That would take too long, and it would also mean that we are in too close of contact, holding and touching and being around that seal too long and too often. The quickest and most effective way to feed a seal when they're not able to eat full fish on their own is with a tube. It does not hurt the animal to be tube fed. It allows us to do the job very quickly, minimizing the stress to the animal. To tube feed a seal, we measure the tube from what would be the mouth down to the stomach. We want to make sure that our tube does not touch the patient during this time when we're measuring and get contaminated. We'll go ahead, without letting the tube touch anything else, try our best to measure from the nose to where that flipper would extend back to about here. Once I have that measurement, I'm going to hold on to it with my fingers, just like I'm doing here. Here's that spot in this hand. So I know that this whole part of the tube will have to be inserted gently through the mouth and down the esophagus to the tummy. Let's go ahead and pretend to do that now. At the National Marine Life Center, this is done only by trained staff and extremely skilled and highly trained volunteers. The next step is to listen. We listen for 3 things. We'll put the tube up to our ear, but not touching. We'll listen for tummy sounds, gurgle, gurgle, gurgle. We will listen for breathing and look for the nares. And we'll also listen for vocalizations, the seal talking if it could. Ow! Once we have 2 of those 3 signs, we can then put the formula down the tube. Remember, to get a medication or something up into your syringe, pull back on the plunger to fill it. Then we would attach. Once your syringe with the pup formula is attached, we let our team know we're ready, and we say plunging, plunging. Then we would pinch the tube and pull out. When I'm pinching the tube, it looks like this, just like we stop a hose in the summertime. Those are a few of the treatment options that you can prescribe as a veterinary practitioner today. What treatment options would you recommend for this patient? Great job. The last and one of the most important things that we do as a veterinary team is to host rounds. Rounds happen at the National Marine Life Center every Tuesday morning. You can have your very own rounds right now in the comments below. Go ahead and tell us a bit about your patient. Let us know the patient's name, any problems you diagnosed, and maybe even what treatments you would recommend. Rounds allow other veterinarians that are at the National Marine Life Center and now all over to learn more about the other patients we're treating so that they can also assist in their care when need be. See what you can learn from the other patients and the other veterinarians as they post in the comments below. Thank you for joining me today for Marine Animal Medical Mystery.
I hope you all enjoyed our Marine Animal Medical Mystery Seals edition. We'll be back on Friday with our Marine Animal Medical Mystery Sea Turtles. If you want to learn more about the rehabilitation process and admission process for a sea turtle at the National Marine Life Center, You can tune in tomorrow for a special Earth Day celebration at 1 o'clock and on Thursday for a Little Flippers story and craft time, also at 1 p.m. Thanks for tuning in, and I can't wait to see you back next time.